I called one of my friends and I said, I've got a melanoma on my eye. And she said, are you kidding me? I go, no. And I said, I don't even know how to process this. I don't even know how to begin to process this.
But I grew up in a family where my father died of cancer, my mother died of cancer, and I have a brother and sister that died of cancer. So I'm really sensitive to that, to the C word. So when it came out, obviously there was some apprehension on my part.
Well, unfortunately, I had been to 2 different dermatologists and they had missed it. It had been misdiagnosed. I noticed this thing on my nose that looked like kind of a plugged sebaceous gland. Every time I checked it out with a dermatologist, said, no, it's fine, it's not cancer, and turned out to be. Yeah.
And she was 6 months old whenever I got the official diagnosis, and then that same week, a girl that I went to high school with, her dad had just passed away of melanoma. And so when you hear that, and then you hear that diagnosis, you kind of go to freak, or I went to freak out mode.
I mean, it started off with just dry skin. Like, it just looked like dry skin, and it just never went away. Just tried like face lotion, all kinds of stuff, and it just continued to come back.
I really enjoy what I do. We have the unique opportunity to be able to talk to our patients while we're doing surgery. So as a way to comfort them, the nurses are always talking to them and asking them questions, and we get to hear intimate details about people's lives and just stories that amaze me.
Well, there's about 3 main types of skin cancer. The most common is basal cell carcinoma. It usually starts as a little pearly or shiny area on the skin that bleeds easily, and it's the least serious. So it's pretty easy to take care of and rarely spreads. The second type is squamous cell carcinoma. It usually looks more warty or scaly on the skin, and it can be a little more serious. It can be a little more aggressive. So over time, if you leave something like a squamous cell on the skin, it can spread to lymph nodes or other organs. The most serious type of skin cancer is melanoma, and it's the type that usually arises within a mole. And it can be a new mole, or it can be a mole that you've had forever. So sometimes people come in and they say, well, I've had that spot forever and ever. But that doesn't mean that it's not cancerous. Because if it grows, changes, especially if it gets really dark or gets more than one color within it, then we get really concerned that that mole is turning into melanoma. And melanoma can be deadly. If you don't get it quickly, it can spread and really be a major problem. Well, I mean, the real thing is that the sun is not our friend when it comes to skin cancer. So when you're out, you do need to wear sunscreen. And I tell people it really needs to be a habit. You need to put it right by your toothpaste, and you need to put your sunscreen on. Just like you brush your teeth every morning, you need to put your sunscreen on.
I would wear sunscreen.
I go to the tanning bed.
Yeah, I was about the same time that I started coming here to get skin checks, I had decided on my own, like, the tanning bed's stupid, don't go there, because I started reading up on it. And I wasn't somebody that went religiously, but I did. Before prom, I would go to the tanning bed. Before cheerleading tryouts, I would go to the tanning bed. So I definitely wouldn't do that.
Because I think, oh, what's 10 or 15 minutes in the sun going to do to me? But since then, I never leave outside without sunblock or without a baseball cap on. And in fact, at work, where I work, I've kind of done a public service announcement to the people, and I showed them the scar in my head, and I said, this can happen to you if you're not careful.
So not bake in the sun. It's not the fact that you can't go out in the sun, but go out there with some kind of responsibility to, this is the only skin you've got for the rest of your life. You might want to take care of it. Wear the hats and the long sleeves, and you know, you can still go out and have fun.
Well, I think that's a good question. I think one of the things that I realized is that I think most people know their body, maybe sometimes better than maybe a professional, and something that doesn't look right, be persistent. And if you don't feel satisfied with what you're hearing, be a little more aggressive and move towards an earlier response. We need to have a biopsy here so everybody's going to sleep better.
Don't ignore the warnings. Sunscreen is readily available, and it's fairly cheap. So just use it. I mean, if you're going to be outside for a prolonged period of time, just use it. I mean, I know it seems like a hassle to have to, I'm going to go mow the yard, so I got to put this sunscreen on, but just do it.
Premier is like family. You know, you don't feel like you're in a clinical setting. You know, Katie always gives me a big hug.
You never felt nervous. They explained everything up front, and it was just very calm and casual. I mean, this is what they do.
It's a process, and the biggest thing is let them know that we're there for them. We're not gonna just cut it out and remove the stitches in a week and they go on. I tell them it's gonna take some time. I try and be realistic with them and explain the process so they best know what to know, what to predict as far as their own healing.
Yeah, I mean, I remember the day we came in to kind of discuss the options, right? And I can go back there pretty quickly, and I don't know, it was calming and reassuring.
But I was truly blessed to find such incredible doctors and staff and here at Premier Dermatology.
You're very apprehensive when someone comes back and says you have cancer. But again, Dr. Allen was so good and prepared me for the options. And her follow-up, she called me to make sure things were fine. And since then, I've come in for checkups. She just checked me today to make sure it was healing. And she made a commitment with me that she'd be there every 6 months, check me again, and that this isn't the end of the journey, but she's going to be there with me. And that kind of personal commitment is really unusual today. And it makes all the difference in the world. There's a trust there that I have with Premier and Dr. Allen that I recommend to everyone.
Prevention is key. So if you can get a lesion early, it's easy to take care of. It leaves you minimal mark or scar. Most people never even see the mark after we take off a skin cancer if we get it early. So the longer you wait, the worse the possibilities are. So it's crazy to wait, and we're not near as scary as we look. So come on in, we'll take good care of you, we won't hurt you. It's really